60 Minutes Overtime.
60 Minutes took a ride on the Health Wagon this week. Run by two nurse practitioners, Teresa Gardner and Paula Mead. They navigate the hills and hollers of Appalachia in a beat-up Winnebago and bring free health care to the working poor who are not eligible for Medicaid but can't afford insurance.
How are you doing, Miss Barbara?
I'm all right. How are y'all?
Doing good. You be careful, honey.
A lot of these people don't see a doctor until they're so sick they have to go to the emergency room, and then it's too late.
Exactly. And that's kind of the patients that we get in. They've got multiple disease states going on.
We, at some point, need to get an x-ray.
Somebody having heart attack, stroke symptoms, the blood sugar's through the roof, their blood pressure's off the chart.
Your blood pressure's 172/90.
I know.
Okay.
It's not good.
Yes, no, it's not good.
They're so ill when we get them in.
It's not the first time Scott Pelley and the 60 Minutes team set foot on this Winnebago. Here they are back in 2008.
This can be very tight, I'm told. Hey, how are you?
In footage that never made it onto the broadcast.
This is the smallest doctor's office I've ever seen. I'm Scott Pelley.
Pelley was in Knoxville, Tennessee at the time, reporting a story called Lifeline.
Recently, we heard about an American relief organization.
It was about a charity that airdrops doctors into remote areas of the third world.
This charity, founded to help people who can't reach medical care, now finds itself throwing America a lifeline.
Is that painful there?
That charity, Remote Area Medical, or RAM, set up a massive clinic for a weekend. Among the RAM volunteers that day was nurse practitioner Teresa Gardner.
For the videotape, let me get your name again, please.
Teresa Gardner, Teresa.
While chatting before the interview, Pelley learned that providing free health care for the working poor wasn't just a weekend gig for Teresa.
But you're doing this all the time, not just at the Rams. This is your regular work.
This is my regular work, yeah.
Fantastic. Are you all set? Everybody ready?
Yeah, I'm very nervous. You didn't show it.
Watching Teresa Gardner work, watching her interact with the people who came in, people who lined up outside that van who may not have had seen a doctor in years, people who had pretty serious conditions.
We're really glad that you came in, especially given, having that high-grade dysplasia that could be precancerous.
To see her deal with each individual with so much compassion and caring. We left that story back in 2008, but we never could leave our memories of Teresa. And she's kind of been haunting us all of these years. Henry Schuster, the producer, and I, we were so moved and inspired by what they were doing. Henry has, for years, wanted to go back and revisit that story. So this time we looked at it again from the viewpoint of the Health Wagon.
There's a feel when you're in the Health Wagon that it took me a long time to put my finger on, and it's the feel of a country doctor. You see this little bitty old Teresa, and she's driving this big old Winnebago through the mountains, and your producer brain is going, that's got to be a story.
And it certainly was. For many people in Appalachia, the Health Wagon is their only option for medical care.
And again?
Now, you have a small clinic in town. Why is it necessary to get on this rickety old bus and drive in and out of these hollers everywhere?
A lot of patients do not have adequate transportation, so us being able to take the mobile van out to the community, and in turn give that access to health care is critically important. It's very innovative to take the health care out to the various communities.
The patients can't come to you.
No, because you're looking at an economy, a lot of them do not have cars that can make it. They cannot afford the gas at the price of gas now. Plus, if you're talking about, 20 miles here, it takes us 45 minutes to go 20 miles because you're going on crooked roads, up hills, down mountains.
In the 6 years since the first 60 Minutes story aired, not much has changed.
You've got a poorer population now because of the decline in the coal industry. It's not just that they can't afford any sort of insurance that might be available to them under the Affordable Care Act. It's that this is a horribly underserved region in terms of medical resources.
Medicaid in those states is just for the destitute, for the very, very poor. And these folks, many of whom work full-time at minimum wage, make too much money in those states to qualify for Medicaid, but they don't make enough money even to buy insurance on the healthcare exchanges. So at least 5 million Americans now fall through this gap, and they're in the same place they always were, without health insurance and unable to buy it.
And since that first story, several 60 Minutes staff members have volunteered at various RAM events in Appalachia.
Scott's family and my family went down that summer, and we worked at their biggest RAM event in Wise, Virginia.
Well, as a volunteer, we did a lot of things. We made a lot of eyeglasses. They trained me how to grind the lenses. It's all done by computers and things, so you just tap in the right numbers in the right places. I learned how to do that. So now I have something to fall back on if this journalism thing doesn't work out so well.